Hi everyone, welcome to yet another episode of Pathway, and today we will be discussing on another topic from recent advances 25, and that is severe pathology and mortality associated with COVID-19 vaccination. This is an autopsy based topic, so the results are based on the autopsies conducted on post COVID-19 vaccination deaths. I know this is a bit of dry topic, so I have tried my maximum to make it interesting by adding colors to the PPT, and I have made it ASAP, that is as short as possible for you guys. So this topic I'll be discussing under three small headings, that is pre-COVID-19 vaccine related deaths, complications of COVID-19 vaccine, and the responsive pathology. So coming to the first topic, that is pre-COVID-19 vaccine-related deaths. That is, the vaccine-related deaths that has caused before the COVID-19 pandemic. As we all know, any vaccine has an innate complication of causing acute anaphylaxis in any individual because the immune response can be unpredictable at times. And there can be syncope attacks due to injection phobia, etc., and subsequent trauma has led to death in rare cases. And most of the fatal outcomes were related to vaccines against infections itself. So now you will be asking, vaccines are against infections itself, right? Is there any other type of vaccine? Yes, there are vaccines that are used to treat cancers like prostate carcinoma and melanoma. So among the vaccines, the culprit vaccines were found to be those which were attenuated live virus or live bacteria. So, as we all know, these vaccines are produced for the very good cause of the human beings, and the complications and deaths that we will be discussing here are just very rare reported cases. But as such, if we encounter it in practice, it is better that we have to know about it. So, most of the vaccines, that is HPV, MMR, rabies, hepatitis A, B, have no known fatal cases as of now. But you have to also know about one case or one syndrome to be kept in mind, that is ADEM, acute disseminated encephalomyelitis. ADEM is a syndrome which is usually seen post viral or bacterial infection, but it can be seen post vaccination as well. So, in this case, there will be a brief but widespread demyelination of the brain and the spinal cord, which is due to delayed hypersensitivity reaction, and it can cause neuronal damage, and in fulminant cases it can even lead to death. So the vaccines that is found to cause death reports are BCG and varicella vaccine that has caused disseminated infection in rare cases, even in immunocompetent persons. Smallpox vaccine, which is recently used for monkeypox cases, has known to cause the disease itself. Yellow fever also has caused systemic disease and systemic inflammatory response syndrome. Oral polio vaccine, as we all know, has caused poliomyelitis, and H1N1 has caused Guillain-Barré syndrome. So now coming to the topic proper, that is the fatal complications of COVID-19 vaccination. So before that, we have to know that there are 4 types of COVID-19 vaccines. That is live attenuated virus, in which a live virus, its weakened part is given to produce immune response. And then inactivated virus, which I don't have to explain, I guess. And then mRNA vaccine, in which the messenger RNA that encodes for the COVID-19 viral protein is given to produce subsequent response. And in adenovirus vector vaccine, adenovirus is used as a vector which contains the genetic material that encodes for the COVID-19 viral protein to induce immune response in the individual. So among these, the first 2 ones are not found to be culprits in most of the cases, and it is the last 2 ones that has caused fatal complications. So what are the fatal complications? They are VITT, myocarditis, vasculitis, and other syndromes. So coming to the first one, that is vaccination-induced immune thrombotic thrombocytopenia. As the name suggests, it is vaccination-induced immune mediated, that is immune complex that has been caused due to vaccination, that has caused formation of thrombosis. And thrombosis, because of its extensive formation, there is decrease in the platelet count. So, in this syndrome, you will get fatal thrombosis in unusual sites. What are the usual sites? That are deep vein thrombosis, etc. And here you will see it in dural venous sinuses, splanchnic hepatic vein, or splenic vein. And these thrombosis has caused cerebral hemorrhage, hepatomegaly, splenomegaly, arterial thrombosis and renal glomeruli, as well as coronary artery thrombosis that has led to myocardial infarction. So the pathogenesis that was found from the research was that in these individuals there was high circulating amount of immunoglobulin G, which was found to be against the platelet factor 4, and this complex has activated platelets and that has caused thrombosis in unusual sites. So as you all can see, there is a histopath image. So in this you can see the choroid plexus, and in the blood vessels there are thrombosis. So the next complication is myocarditis, which you all know that is the inflammation of the myocardium. So this diagnosis is mostly diagnosed based on the clinical features and the imaging. And very less cases were diagnosed by biopsy or autopsy findings. And this was usually found to be caused by mRNA vaccine more than the adenovirus vector vaccine, whereas in the VITT it was the adenovirus vector which was the culprit. So there was a Della's criteria that was put forth by the researchers to diagnose a case to be post-COVID vaccination which has caused true myocarditis, and then you have to have a feature of myocyte necrosis or degeneration along with moderate to dense inflammatory infiltrate. And to call it as borderline myocarditis, the myocardium should have mild inflammation and edema. So this Della's criteria was used in the living state myocardial biopsy as well as an autopsy to report as myocarditis to be the cause of post-COVID-19 vaccination death. So among the studies it has been found that it was mostly true myocarditis that was caused after vaccination, and borderline myocarditis was seen to be associated mostly with COVID-19 infection as such than the vaccination. So pathogenesis was found to be that post-vaccination the antibodies produced, which was to be supposed to be against the COVID-19, has cross-reacted with the myocardial contractile protein and caused myocarditis. And rarely there was found to be few cases of fatal fulminant eosinophilic myocarditis that was caused due to hypersensitivity reaction. So here you can see a histopathology image in which there is moderate neutrophilic inflammation in between the myocardium, which represents, according to Della's criteria, a true myocarditis. So vasculitis is the next complication. So as you can see in the picture, there is cutaneous vasculitis after post-COVID vaccination. There can be also gastrointestinal manifestation of the vasculitis. And the researchers has found to be that it was ANCA negative and immune complex mediated necrotizing vasculitis, which mostly involved the small arterioles. So histologically you can see cutaneous blood vessels which has necrosis as well as neutrophilic infiltrate. So what do we call it? There is leukocytoclastic and necrotizing vasculitis. So the other syndromes that were found to be associated which were causing fatal complications was the reactivation of latent varicella infection in post-COVID cases, COVID vaccination cases. So it was found to be that the patient had clinical herpes zoster after vaccination. How did this reactivation happen? The theory is found to be a cause called immune perturbation. So what is immune perturbation? That is, after the vaccination, the immune system has been modulated. The immune cells, that is granulocytes and the lymphocytes, the markers over that the proteins they are expressing, the gene expression has been modulated, and they have caused reactivation of the varicella infection. There was also found to be interstitial lung disease, which was diagnosed mostly by radiological imaging than by histopathology. And there are other diseases or complications that was found to be due to COVID-19 vaccination, but there was no significant amount of evidence. Those are hemophagocytic lymphohistiocytosis, Rett syndrome, and some autoimmune diseases like glomerulonephritis, lupus, idiopathic pulmonary fibrosis. So, coming to the last topic, the response of pathology. So, what does it mean? It actually is telling about the guidelines how the COVID-19 vaccination autopsy has to be done. You have to take a case under this only when it is within 3 weeks of the post COVID-19 vaccination. And special attention has to be given and taken samples from blood vessels, brain, dura, lungs, heart, kidneys, and splanchnic viscera for the complications like VITT, myocarditis, etc., which we discussed. And then you have to perform clotting studies with pre-mortem blood samples. Sorry for the spelling mistake. Pre-mortem blood samples, which when the patient was admitted, it must have been given for CBC and other studies. So with that blood, you have to perform clotting studies and anti-PF4 antibody. So with this, we come to the end of the PPT. Hope it was informative for you guys. So thank you for listening patiently. Kindly like, share, subscribe, and give your valuable comments below. So it's me, Dr. Lavanya, signing off. Have a nice day.